Interventional radiology is a medical specialty that involves a physician that has specialized training in not only diagnostic radiology, but also in performing minimally invasive medical procedures using image guidance. So examples of this would be something like a percutaneous tissue biopsy. These interventional radiologists will use, for example, a CT scan to advance a needle through very tight windows in the body to sample tissue deep within the body. Other types of things that interventional radiologists do is through the bloodstream. They can thread catheters through the bloodstream to deliver drugs to specific organs in a targeted fashion. Other things they can do involve tumor therapy, where you can put a specialized needle through the skin into a tumor and kill it using either cold energy or heat energy. There's a wide variety of things that interventional radiologists do. With regards to lung cancer care, there are multiple ways in which you might run into an interventional radiologist. For one, interventional radiologists play a large role in establishing a tissue diagnosis for lung cancer. Many patients with lung cancer need to have an image-guided biopsy performed, and that procedure is typically done by an interventional radiologist. Sometimes that biopsy is of the lung tissue, but sometimes it also involves biopsying something in the bone, something in the liver, something in the adrenal gland. Really, any part of the body is something that can get a tissue biopsy with an interventional radiologist. Other ways that you may come into contact with an interventional radiologist comes with regards to the means in which you will receive your chemotherapy. Most patients, or many patients I should say, will have what's called a portacath placed to receive chemotherapy. It's a specialized implantable catheter that goes completely beneath the skin, and it can be repeatedly accessed for you to receive chemotherapy, so that you don't have to have an intravenous line established in your arm every time that you need chemotherapy. The last way in which a lung cancer patient might come into contact with an interventional radiology is actually in regards to treatment of lung cancers. I spoke earlier about a procedure using heat energy to kill tumors. That, in a broader sense, that's known as thermal ablation. And thermal ablation is a treatment option for many patients with early stage lung cancers or patients with metastatic deposits in the lungs. And that procedure involves putting a specialized needle directly into the tumor in the lung. And then that tip of the needle will create a zone of heat that will kill the tumor. And in many ways, this is a viable option for many patients with early stage lung cancer.